August is Hair Loss Awareness Month. Dr. Richard Chaffoo is back with insight on the condition millions of Americans face. I know many of those. Good morning, and thank you for being here. All right, what causes hair loss to begin with?
So, hair loss can be hereditary or non-hereditary, but we know that most common hair loss is what's called androgenic alopecia, and that's a progressive, permanent hair loss that affects probably men at the age of 40% of men at 50%. Women, by the time women get to be in their middle 50s to 60s, 40 to 50% of women are affected by hair loss. So we know there's a genetic component, Shirley, but not everybody has a genetic tendency. But there is something within our hair follicle in many people that just stops hair from growing at some point.
Is it true that if mom or dad, or what are those folk tales that said if dad has it, then you're going to get it?
Yeah, it used to be, we used to think it was on just the mom side of the family, but we've actually done studies and found that there are about 12 sites on our chromosomes that are linked to hair loss, one of which may be hereditary, but they're not all hereditary. And we used to think it was just, as you said, on the mom side. We can see it on the dad side, both sides, or neither one.
All right, what can you do to prevent it?
So the first thing is a good diagnosis. So get in to see somebody that deals with or is an expert with hair loss. Find out what the cause is. The most common thing, as we said, is androgenic alopecia. And then you want to do things to, number one, prevent further loss, and then to get some hair growth back again. There are good medications and treatments available for those.
And then once you lose your hair, is it gone? Like, can you?
Not necessarily. If it's early on, there are treatments that can actually restore some of that hair loss, but you're right. If the hair loss has gone on for many years and there's no hair growth at all, usually at that point, that's the time where we look at hair restoration or hair transplant surgery.
Is it true that when you bleach or you color your hair, you're going to lose your hair?
You can, as certain harsh chemicals can temporarily damage the hairs. The hairs will crack or break and shed off. They'll usually come back, but there are certain hairstyles, tight hair, they call that the man bun now. We're seeing that in men and women, obviously ballerinas, any style where you're, cornrows or really tighten, straightening. All those treatments can tend to pull on the hair and the hair roots and cause a temporary thinning.
And if you notice that you do have that hair loss, I mean, now in 2025, there's so many things that you can do.
Yeah, there is. We wrote a book about hair loss. It's called Hair Loss Solutions, The Ultimate Guide to Restore Your Hair Loss. And it's a book that my wife, Dr. Susan Seward, who's our dermatologist and treats primarily or more often female pattern hair loss, but it goes over everything A to Z. It's on Amazon, and it really gives the public, information about what's the science, what's superstition, what works, what doesn't work, where's the research going. So it's really helpful. I tell it's sort of like the Cliff Notes of hair loss.
Amazing. Well, good information. Thank you for stopping by and telling us all of that. If you want to get more information on Dr. Chaffoo, you can go to our website and click the Seen On tab.